Okay, so we're back live, and this is Senate Health and Welfare. And we're joined by Meg. You can introduce yourself for the record. But thank you for being here and bringing everyone in to share with us. Appreciate it.
Thank you for having us. Would you like to just maybe have the senators say their names and their districts, since the advocates don't know everybody in the room?
Let's do that. Why don't we just all go around and introduce ourselves around the entire room. So you start.
So my name is Meg Polite. I'm the policy director here for the Alzheimer's Association.
I am Martine Rock-Ulick. I live in Burlington. I represent Chittenden Central.
Good morning. I'm David Weeks. I live in Proctor and I represent Rutland County.
Ginny Lyons. I live in Williston. I represent Chittenden Southeast, and I wore purple yesterday. Big E.
We're working on it.
I'm Terry Williams. I'm from Pulteney and I represent Rutland County.
And I'm Ruth Hardy. I represent Addison District and I live in East Middlebury.
And why don't you each introduce yourself?
Just real quick, say your name and where you're from.
Hi, I'm Abby Palazzo from Colchester.
I'm Daryl Rudy from St. John's Ferry, Vermont, and I have Alzheimer's.
I'm Barbara Edelman from St. John's Ferry, and I'm with them.
I'm Gusam Alzabay. I'm a legislative intern. I live in Middlebury, Vermont.
I'm Liz Plaza and I live in Colchester.
I'm Mike Palazzo, and I'm Alzheimer's.
I'm Pamela Smith. I have younger onset Alzheimer's from East Middlebury.
I'm Jenny Craig, and you're from Rutland County this time.
Yeah. She has Alzheimer's. And I'm Betsy Bianchi and I'm from Killington. That's my mom. In case you're wondering.
John Bowden. I'm from Hartford.
Judy Simon Boughton. I am from Woodhughes. It's been a good 20 years or so. My father had Alzheimer's. I think my brother wished my mother had Alzheimer's. But it's a nasty disease.
Yes, it is. Yes, it is. We worked with you last session, and it's really terrific to see everyone coming back in. So you have something more.
Thank you so much. Yes, so we each have, not each of us, but a select number of us here have 2 minutes or less remarks that we thought we would share with you. And then if there's any time before that and lunch, we're happy to chat a little bit more and we'll be here. So I will kick it off. My name's Meg Polite. I'm the policy director for the Vermont chapter of the Alzheimer's Association. And we're so happy to be here as part of Alzheimer's Awareness Day at the State House. And we're here on behalf of 13,000 Vermonters over the age of 65 living with Alzheimer's, a number that's going to grow by more than 30% to 17,000 in the next 2 years. We also represent many, many Vermonters who are not included in these numbers. These are Vermonters diagnosed before the age of 65, who have younger onset Alzheimer's, those who are misdiagnosed, and those who do not have a diagnosis. And we're all here in support of the unpaid dementia caregivers. These are primarily family members, and in 2022, they provided 28 million hours of unpaid care to loved ones in Vermont. Your colleagues in the House added a state dementia coordinator to the FY24 budget, and today we're going to be sharing the realities of living with and caring for someone with Alzheimer's or another dementia. 23 other states and the District of Columbia have a permanent dementia coordinator paid for with general funds, and 16 states, including our own Vermont, are trying this year with legislation to make that happen. Attached to my testimony, you will find additional facts on the impacts of dementia and how a state dementia coordinator will help Vermont create a comprehensive system of dementia care. So we're asking you to please support that system in the FY24 budget. I do have fact sheets if you want a paper copy, or Alex has them. So I'm going to invite you now to hear directly from the Vermonters who have come to the State House and to share their stories today. And you all know, if you do work on this, you can always reach out to me. I'm happy to come back and provide you with data, information, or connect you with more voices of people with lived experience. So first up is going to be Daryl Rudy.
Hi, and I'll say it again.
You can sit right here, Daryl. Daryl, sit right here so the camera picks it up. Thank you.
So my name is Daryl Rudy.
for the third time. And I'm here to share why Vermont needs a state dementia coordinator. And I'll say that one again, we need a state dementia coordinator. Like more than 13,000 other Vermonters over the age of 65, and probably many more who won't be diagnosed. As I said, I have dementia Alzheimer's in my case, and I will die with this disease. I want to spend the rest of my life with my amazing partner, Barb, living together in our St. Johnsbury home. Not only would this choice fill my deepest heartfelt desire, it also is the most cost-effective for us and for the state. In Vermont, there currently are over 26,000 unpaid dementia family caregivers like Barb. All of them are working to navigate a disease that is long, complex, and I'll say it again, and terminal. Many of them also have jobs and are taking care of kids and other family members. They need help. Vermont has amazing organizations and people doing the best they can to meet our needs, but this system is often fragmented, and even in little Vermont, there's a lot of variance depending on where you live. There are so many different pieces that must be juggled by those of us dealing with this disease, and this places an unbearable burden on families. I'm asking that you keep the funding for a state dementia coordinator in the fiscal year 24 House budget. That's a biggie, so that people like Barb and me have a point person to ensure access is available and equitable across our state. This to me is a small amount relative to the state budget and so important. A dementia coordinator will provide Vermont doctors, service organizations, unpaid caregivers with the resources and structure they desperately need to cope with dementia in the most efficient and cost-effective way. And I thank you very, very much for listening to me.
Thank you. Thank you very much. So we're gonna let you switch seats. Yeah, this is great.
He's a tough act to follow. I don't know if I like this or not.
Yes.
So good afternoon. My name is Betsy Bianchi, and I'm here today with my amazing mom. And we greatly appreciate this opportunity to advocate for keeping the state dementia coordinator in the fiscal year 2024 budget. My mom was diagnosed with Alzheimer's 8 years ago and has been living in Rutland in an independent living facility for the past 6 years. During her first 4 years in Rutland, she thrived, didn't need any help. As the disease has progressed, she's needed more and more assistance. And since she's still very social, none of the memory care facilities within an hour and a half from our home are appropriate at this stage of her disease, because very few, if any, of the current residents are verbal anymore. Unfortunately, our local assisted living facilities are not willing to admit her either, because we're unable to guarantee that she would press her button if she needed help. So to meet her needs, she now either has a dedicated one-on-one caregiver from at-home senior care or myself with her whenever she is awake, and caregivers periodically checking in on her all night long. Because of the shortage of caregivers, I was forced to give up my engineering career much sooner than planned to allow me to cover as an unpaid caregiver the many open shifts that arise each week. Although there are some excellent resources in Vermont, we're really lucky about that, finding them is extremely challenging. Both unpaid caregiving and searching for resources is exhausting. It's overwhelming, it's debilitating, and it robs our family of the precious time to just be with my mom while she still knows who we are. A state dementia coordinator will serve as a point person to help create a clear system for physicians in their diagnosis and care, and for families as they navigate the changing requirements of this disease. Funding a state dementia coordinator not only helps Vermonters better utilize our current resources, but it's a beautiful way to unite our state behind a devastating disease that significantly impacts every single community in our state. So thank you.
Thank you, and good luck.
Yes.
Yeah,
It's tough.
it's
It's
tough.
tough.
We understand.
I'm very lucky that I have such a great mom.
Well, and she was laughing at your jokes too, so. Makes her even better.
Hi, I'm Abby Plaza. I'm from Colchester and I'm a senior at UVM studying health sciences. I'm here to speak in support of the state dementia coordinator position that is in the fiscal year 24 House budget. I have 3 specific areas that inform my belief in the value of this position. First, here with me today are my mother and father. At age 50, my dad was diagnosed with younger onset. At this time, both of my parents were working and I was a full-time student. Within the 3 years following the diagnosis, my family has had to transition from work to retirement, manage financial and legal matters, and adopt full-time caregiving roles, all while supporting each other through the emotional journey of this disease. The addition of navigating resources meant to help us felt overwhelming. Second, I work as an LNA in memory care. I see firsthand the complexities of the dementia, the strain it puts on systems of care, and the challenges it places on families and the workforce. In my experience, person-centered care has had more positive outcomes when there is a consistent workforce and an environment that creates relationship building opportunities with patients. There's also a need for training on human behavior and communication strategies to better support the patient. With these systems in place, I see how unnecessary stress on the patient, worker, and their families can be reduced. Third, I've conducted research at UVM with nationally representative data, and findings reveal low use of external support services by caregivers and low participation of people with dementia in organized activities. Thus, there's a pressing need to increase access to a system that will provide wraparound services for people with dementia and their caregivers. I believe the state dementia coordinator is vital if we are going to create a sustainable, affordable, and humane system for those living with dementia at all ages. I ask this committee to support this position in the fiscal year 24 budget.
Thank you. You must have very proud parents. Seriously, I can tell. Thank you. And thanks for your caring for your family.
I'm Pamela Smith. I want to thank everyone for donning the flowers that I make.
Beautiful.
Thank you. The flowers indicate one's personal relationship to Alzheimer's and other dementias. As you can see, I now wear 5. I wear 2 purples for my grandfathers who died from Alzheimer's. I wear a purple for my uncle who died with dementia. I wear a yellow because my mother lives with me and has undiagnosed but very clearly evidenced dementia. She can't afford the diagnostic process. And lastly, I wear a blue because I have younger onset Alzheimer's. My name is Pamela Smith and I was diagnosed with Alzheimer's at the age of 53. In Vermont, 13,000 people are counted as having Alzheimer's. This number doesn't include me because I am under the age of 65, nor my mother because she can't afford the diagnostic process. Nationally, it is estimated that about 6% of people develop Alzheimer's prior to the age of 65, but we are uncounted because there's no easy mechanism to count us. And as I have learned from personal experience, that uncounted often leads to unserved. But I need all the same services as an older person with dementia needs. I've also discovered that Vermont lacks a coordinated system of care for people with dementia. Families have to locate the limited help available. For many, they need to figure out also how to pay for it. I am faced with 4 primary barriers. 1, I am under the age of 60 or 65, thus disqualifying me for some assistance programs. I am in the middle class, so I'll never qualify for Medicaid. My family members have to work full time, so I don't have them to serve as caregiver or case manager. And lastly, when I try to pay for the help I need, agencies don't have staff. Every time I try to figure out whether I do qualify for some assistance, the rules are so difficult that I can't figure out the process or remember the rules on my own, so I give up. I'm doing all that I can to help by using my professional experience as a social worker in the before times and my lived experience with Alzheimer's now. I'm an advocate for the Alzheimer's Association. I've joined the Governor's Commission on Alzheimer's Disease and Related Disorders, the Older Vermonters Caucus, and the Home and Community-Based Services Work Group. This can positively impact those of us living with Alzheimer's if there's effective coordination of a dementia support system, which I hope includes full equity for all of us struggling with Alzheimer's and other dementias. We need a state dementia coordinator to pull together the variety of services into a system to assess effectiveness and frankly, to count people like me and people like you. We need a statewide dementia coordinator to pull together the variety of services into a system. Please fully fund the statewide dementia coordinator position. Thank you for taking the time to hear my story. And I'd like to add how wonderful it is to see a garden of purples, yellows, blues, and oranges.
Oh, thank you. And thanks for making our.
Oh, it's fun. Creativity is one of the ways that you keep the mind going.
It is, yes.
Do we have time?
Is there another one?
There's 2, yeah, we have 4 minutes left.
Okay, well, I think the committee is fine. We would
Yeah.
like to hear what you all have to
Thank
say.
you. Thank you very much. I'm Barbara Edelman, and as you've heard, I'm the care partner for Daryl. Daryl is still in the early stage of the disease, so the demands on me currently are relatively light. But I know things will gradually get much more difficult, and I am doing everything I can to be ready for the challenges ahead. Unlike many people in my situation, I have the time and flexibility to do so. I currently attend 2 monthly caregiver support groups, and I'm about to join an 8-session weekly support group, and will participate in an intensive caregiver training program through the UVM Medical Center in the fall, all to help me prepare for what's inevitably down the road. No one can tell me how long that road will be or exactly what it will look like. All I know for sure is that at some point, the road will get very rough and stay rough for the rest of the journey, which could last several years. To care for Daryl and keep myself safe and healthy, I will need help. This might mean respite care to fill in for me, or a safe, socially engaging place for Daryl to spend the day. And at some point, I'll likely need some home nursing support, and eventually we will need hospice support. How I will find, coordinate, and pay for all of this while also caregiving is mind-boggling. The wide variance in how Alzheimer's manifests makes creating a system of care extremely challenging, and that is why Vermont needs a state dementia coordinator to focus on the latest and constantly evolving training, treatments, research, state and federal program requirements, and funding opportunities to close the gaps for us, and to identify appropriate cost-effective solutions to what is a growing challenge for our state, given that we have the 3rd highest median age of any state in the nation. Please support this critical position in the FY24 budget on behalf of the more than 26,000 unpaid family caregivers like me in Vermont. Thank you so much.
Thank you. Thank you for your work.
Excellent, super. Thank you, really appreciate you hanging in here for an extra couple of minutes here so that we can have our say. My name's John Boughton. I live in Hartford with my wife Judy. Judy has Alzheimer's. And I'm here to ask you to support the state dementia coordinator position that's included in this upcoming budget. We're both 72. We each work in service to our communities. Judy is an elementary school teacher where she taught, brought art programming to schools, and helped students learn how to read. I was a county forester, and so that is a forestry advisor and education to the public. Now that we're retired, we have pensions, we have Social Security and savings. We could be volunteering our time with communities of interest, and we could be enriching our grandchildren's lives. Instead, this disease keeps us close to home. And I honestly no longer leave the house without Judy unless I can find a friend to spend time with. We're among the lucky ones. Our health insurance pays for annual checkups, which led to a referral to the neurology department at Dartmouth-Hitchcock, which led to a diagnosis of early onsets about 3 years ago. Dartmouth Aging Resource Center has a no-cost dementia support program that we're taking advantage of. It's been a tremendous help to me. I've been also taking those online support courses, support groups, and also an 8-week course, the same one that I took about a year ago. Savvy Caregivers is very good. So I'm trying to figure out how we can navigate this future. I just can't emphasize enough. You've heard enough that dementia it's horrendous. It's awful. I don't think we would have survived this past year without the resources that we found and the knowledge that wonderful people are available to listen and to offer help and support as we need it. Now, I know that I'm not alone facing these challenges. There are more than 26,000 unpaid dementia family caregivers in Vermont, and you've heard from some of them here. I'm sure there are many that are far worse off than we are. I worry, quite frankly, that folks who live further away from medical facilities than we do and further away from family. We have a son and a daughter-in-law who live in the same town as us, and they can help. Are going to have a much more difficult time navigating. Allison, good to see you.
I apologize. Oh, that's okay.
That's an entrance.
Are you all right? Senator Clarkson, are you all right?
I'm sorry. Yes.
John was sharing with us.
I know, health and welfare is so unbalanced. Okay, I'll come back. I'm sorry, I thought the door was supposed to be moving.
After that entrance?
We'll be done
But I
in
That was quite an entrance.
30 seconds.
Great entrance.
They're good friends, so the
I'm
same
glad
lesson.
that you're friends.
We've known Allison for a number of years, and this must be, that was an unusual entrance. So anyway, I'm sure that there are a lot of people that are a lot worse off than we are. We were the people that are further away from medical facilities and family support have a much more difficult with this. I also suspect that a statewide coordinator of dementia treatment and family support could really make a difference in making excellent services available throughout the state for those families living with Alzheimer's and other forms of dementia. You guys can help. I'm asking you to please, as you work on bills from the House, to keep funding for a new position of state dementia coordinator in the legislation, so Vermont can build an equitable, efficient, and sustainable system of care for those of us who are dealing with dementia and Alzheimer's. Thank you.
Thank you. You did that marvelously, even after. Yeah. Thank you both. And you're a forester and did you work at UVM for a while or do your?
I worked at UVM for a short time. I filled in as extension forester for a year when Tom McAvoy went away for a year. Do we have a connection through UVM?
I think so. We'll talk. Yeah, that's great. Thank you.
You know, this old
Yeah.
brain.
Wow, all of them. Thank you all for being here, and we're gonna go on live and we're gonna end our meeting, but we can't tell you how much we appreciate your dedication to one another and to the issue, and we'll do what we can do.